I'm Ashley. I'm going to be your nurse practitioner student today. I'm going to be performing the head to toe physical assessment. Do I have your permission to do so?
Yes.
Okay. And then if you could just tell me your name.
Sarah Matrick.
And then your date of birth.
October 16th, 1988.
Okay. And then can you tell me what day of the week it is today?
Wednesday.
Wednesday. And where are we doing this assessment?
Mechanicsburg. So I have to give the address?
No, just my house. Okay, I'm gonna have you just actually move over a little bit just so we can be exactly in the camera. Okay. Perfect. So with that, I can tell that she's learn oriented, speech is clear, and just looking at you, your face is symmetric. So we're gonna start from head to toe and just do an assessment since you've been with me every week. It's just putting everything together now.
Okay.
So first, as I'm looking at you, we're inspecting, obviously this is the first thing that we do. So face is symmetric, eyebrows, the hair on your eyebrows is distributed evenly. If I'm going to start with your head, I will look at your hair.
It hasn't been cleaned for a while, so.
So it looks clean. There's no dandruff. As I'm palpating through your scalp here and trying to feel for any lumps, bumps, or nodules, lesions, which I don't feel any. Okay, perfect. So then the next thing I'm going to do while I'm doing this, I'll kind of run through the cranial nerves as well. So the first cranial nerve is the olfactory nerve, and with that, I'm just going to have you see how your smell is. So if you can close your eyes and close your right nostril and tell me if you can smell this.
Mm-hmm.
What does it smell like?
Cinnamon.
Okay. And then close your left nostril. Do you smell the same thing?
Yep.
Okay, perfect. So with that, the cranial nerve number 1 seems to be intact. So with cranial nerve number 2, that is going to be tested by making sure that your pupils are equal, round, and reactive to light. So I will get my pen light here. Okay. So just look straight ahead at me. All right, and just keep your eyes straight ahead. Perfect. Good. Okay. So pupils are equal, round, and reactive to light. I'd say your pupils are probably about a 2 millimeter in diameter. The next thing I'm going to do is check 3, 4, and 6 cranial nerves. So with that, we're going to be doing the cardinal gaze. So if you can just stare straight at me again, and I want you to follow my pen. Good. Perfect. That's intact. The next thing I'm going to do is check your peripheral field of vision. So you tell me when you see my fingers, okay? And just keep staring straight ahead at me.
Yeah. Yep. 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 Mhm. 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 Mhm.
Okay, perfect. Okay. So that was 3, 4, and 6. So cranial nerve number 5 is going to be your sensation on your face. So with that, if you can just tell me that everything feels even here.
Mhm. Mhm.
Good.
Yeah.
Okay. And then we'll go to 6 and 7. So with that, if you can raise your eyebrows. Good. Give me a frown face. Okay. Puff your cheeks out. Give like you're blowing a kiss. Good. All right, perfect. So those also seem to be intact. So next I'm gonna look in your mouth. Okay, so open up and say ah. Good. So uvula is midline. You do still have your tonsils. The mucosa, while I'm looking in here, I will look at the mouth. So mucosa looks moist, pink. Teeth are, you can put your tongue back in. Teeth are all healthy, gums look healthy as well. Go ahead and give me a swallow. Good, so that is cranial nerve number 10. And then cranial nerve number 11 checks your accessory muscles. So go ahead and shrug your shoulders. Perfect. Okay, and then lastly is cranial nerve number 12. That's the hypoglossal. If you can stick your tongue out and then from side to side. Perfect. Okay, so that goes through all of your cranial nerves. So while I did that, I also checked off the mouth, looked inside. That looks great as well. So we're gonna keep moving on here. So with the eyes, I'm gonna have you do use the Snellen chart here, 3 feet in front of you here. Just tell me what the lowest line is that you can read.
LTFPH.
Perfect. Okay. All right. So now I'm going to look at your look in your eyes, check for your optic disc, make sure that we can see a red reflex. So going to do that now using my ophthalmoscope. Okay. Good. And then come in close. Perfect. And then we'll do the other side. Good. So optic disc is intact. Red reflex was shown. So that looks great as well. Okay. So next we're going to start with your ears then. So with that, I'm going to test your hearing, which is cranial nerve number 8. That one we missed when we did the cranial nerves in the beginning, so we'll just do that along with the hearing. So I'm going to do what's called the whisper test. So with that, if you can close your right ear, just occlude your right ear. And I'm gonna whisper 2 things into your left ear and if you could tell me what those 2 words are.
Dog, cat.
Good. And then we're gonna do the next side.
Pizza, ice cream.
Good. All right. So let me just get my otoscope ready here. Okay, so we're gonna look inside the eardrum now, or inside the ear canal. We're going to be looking at the tympanic membrane, making sure that's all intact. So as I'm doing that, I'm going to be, for an adult, you hold the top of the ear and pull up. And tympanic membrane is intact, pearly gray. That's good. Any pain when I'm doing that?
No.
Same with this one. Good. Same thing on this side. Okay. All right. Next thing we're going to do is the Rin and Weber test, which is testing the bone to air conduction. So with this, you just tell me which you hear better in the front of your ear or behind your ear at the mastoid process. Okay?
Okay.
First one or second one?
First.
Okay. First or second?
First.
Good. And then the Weber test. You tell me if you hear it in both of your ears, if you have a vibration in both your ears.
Yes.
Okay, good. All right, perfect. Okay, so that takes care of eyes and ears. So now I'm going to move down to your lymph nodes, and we're going to check all of those along with your thyroid. So with that, if you can kind of turn a little bit this way for me.
Oh.
Yeah, whole body, that's good, perfect. Okay, so here we're going to be checking the occipital lymph nodes. Okay. While I'm back here, I'm just going to also check your thyroid. So if you could swallow. Good. Again. Good. So thyroid does not feel enlarged, no masses or bulges, and everything seems midline. So we did check the occipital lymph nodes. So next we're going to go to the postauricular lymph nodes, the preauricular lymph nodes, the submandibular lymph nodes, the anterior cervical lymph nodes, posterior cervical lymph nodes, suprasternal notch here, and sternocleidomastoid lymph nodes. Okay, go ahead and just put your head down for me. While I'm back here, I'm just going to also look at your neck. I'm going to be feeling for C7. Everything here seems to be in place. So this is also, while I'm here, just checking the range of motion. Good. Go ahead and put your head backwards, look up to the ceiling. Perfect. And then your left ear down to your shoulder and right ear down to your shoulder. Good. So range of motion in the neck is good. Go ahead and you can face the camera again, turn back. Okay. So that checks the lymph nodes. Next, I'm going to do the peripheral vascular system. So checking all of your pulses. So first we will check your brachial pulse. Good. Your carotid pulses, which we do one at a time. Perfect. Radial pulses. Then we would do femoral pulses, but for your privacy, we will not do the femoral pulses. Go ahead and put your legs out straight for me. And popliteal pulses. Good. Then we'll do the dorsalis pedis pulse. Good, those are strong. Perfect, okay. All right, you can go ahead and put your legs back up. So all your pulses are +2, regular. Now I'm going to listen to your heart and listen to your carotid pulse again with my stethoscope there. I'm also going to check for any bruits that I may hear. With that, I'll use the bell of my stethoscope. But first we'll listen to your heart sounds. So I'm going to listen to the carotid pulse. Good, other side. Okay. And then listening at the aortic valve, pulmonic, Erb's point, atrial, and mitral. Good. Then with the bell of my stethoscope, I'm going to listen for any bruits that I might hear. So in the carotid, go ahead and just hold your breath for me. Good. You can breathe. And listen into all of the same heart sounds that I just did. Erb's point, atrial, and mitral. Good. So no bruits were noted there, and no murmurs were noted. Did hear S1 and S2, so that is all normal. So next thing we'll do is I'm going to listen to your lungs. As I'm looking at you, if you can just sit up straight for me. So if I'm standing to the side of you, I'm just looking for the sternal border. Any heaves or lifts, which I don't notice any. Go ahead and turn to the right for me. And I'm checking for jugular distension. I don't see anything there. And turn to the other side. Perfect, same. Okay, so now I'm going to listen anteriorly and posteriorly to your lung sounds. You can just breathe normal. When I do move my stethoscope, if you could just take a deep breath for me. Good. So anterior breath sounds are clear, no adventitious sounds are noted. If you could turn a little bit for me. Now I'm just going to listen to the posterior lungs. Okay, nice deep breath. And out. Good. Okay. Good. And other side. Good. Perfect. Same with posterior. No adventitious breath sounds noted, and everything seems clear. So while I'm back here, I'm also just going to percuss and palpate. If you could turn a little bit more for me. Perfect. Okay. So I'm going to just be testing for tactile firmitus. If you can, say 99.
99.
Again?
99. 99. 99.
Good. And then I'm going to just check your expansion. Take a deep breath in. Good. And out. Okay. And everything is symmetric when I'm doing that. So now I'm just going to percuss. Okay. Great. Okay, you can go ahead and turn back. Okay, so that covers lungs and heart sounds. We also did the peripheral vascular system. We checked the cranial nerves. So next I'm going to do the abdominal assessment. So if you can do me a favor, I think actually if you lay here at this side, we should be able to get you in the camera. Okay. All right. So just gonna get down here on your level. We can still see if I can just pull up your shirt for here for a second. Okay. So with this, again, we're inspecting and palpating, looking for anything abnormal. So as far as skin, she does have some freckles and moles, but no scars noted. Go ahead and lift your head up, just your head and muscles seem to be intact here in the abdomen. So that is all good as well. Go ahead and you can put your head back down. One thing that I did not check that I just remembered is skin turgor. So on the hands and arms here, just going to pull up. Skin is elastic, seems to be well hydrated. As far as her nails, there's no clubbing noted. Cap refill is with less than 3 seconds. Good. Okay. So with the abdominal exam, first we want to always auscultate first. So we're going to listen to all 4 quadrants. We're going to start in the right lower quadrant and work our way around. So right lower quadrant first, using the diaphragm of my stethoscope to do that. Good. So with that, she's got some hyperactive bowel sounds in all 4 quadrants. The next thing I'm going to do is listen to the abdominal artery here, and we'll go down through. So the abdominal artery, and then the renal artery, the iliac artery, and the femoral artery. Perfect. Okay, so after we do the auscultation, then I'm going to just percuss, and then I'll do some light and deep palpation. So with the percussing, we will hear dullness over any organ. Good, perfect. Okay, so now just some light palpation. Any pain while I'm doing this?
Mm-mm.
Okay, and then we'll start with some deeper palpation. Go ahead and take a deep breath. Okay, and I do feel the border of your liver, so that's good. Does not feel enlarged. Should not feel your spleen, which I don't, so that's good. You can breathe normal. Okay, all right. So palpation of the abdomen is good. We auscultated and percussed. Okay. While I have you laying down, just going to, I can put your shirt down. So now we'll do the range of motion of your hips. So, and then I'll have you stand up. So with the hips, if you can lift your leg straight up, good, and then back down, flexion and extension, do the other side. Okay, and we're gonna just bend your knee and put your leg across your body. So that is adduction, and then away from your body is abduction. Perfect. We'll do the other side. Okay, good. And any pain in your hips while we're doing that?
Mm-mm.
I didn't hear any cracking, any crepitus with that. Okay, so let's go ahead and have you sit up again. Okay. And, all right. So with this, next part we're going to do the musculoskeletal system. So I already did her head range of motion. We did her hips range of motion. So now we'll start with the hands. So just put your hands out. Okay, so with the hands range of motion, we're going to do flexion and extension, which is up to the sky, good, and then down, perfect. And then with the fingers, abduction will be spreading your fingers apart, and then bringing them back together is adduction. Okay, great. And as we're looking at the musculoskeletal system, we're palpating down through the joints of the fingers here. No pain while I'm doing this?
Mm-mm.
Okay. And then, so now we'll go to the elbows. So flexion and extension is going to be up and then back. Okay, and then across your body is adduction, and then away is abduction. And then we'll do supination and pronation. So, good. Other side. Across the body and away from the body. Okay. As I'm palpating, I am feeling for the epicondyle, so medial and lateral. Epicondyles. No swelling is noted. No pain with that?
Mm-mm.
Good. Okay, so we did hands, wrist. Now we'll do the knees. So with this, just going to put your legs out here. So we're going to do flexion and extension. Good. Other side. Okay. And then we're going to go out and in. Adduction and abduction. Okay. And then palpating, we're going to be palpating the patellar. And then the condyle joints on each side, medial and lateral. The tib fib. And ischial tuberosity. No swelling in the joints that's noted. no redness. You do have a, she does have a scar here. And what is that from?
An ACL repair.
Okay. And then a scar here as well on the left side of her leg, and that was?
The removal of an osteochondroma.
All right, so then we're gonna check the feet and ankles. So with the foot, if you can flexion, that will be flexion, and then extension, good. And then do an ankle circle for me. Perfect, okay. Next side, up and down, and then an ankle circle. Great, okay. And everything looks good here. Checking the ankles, we've got the medial and lateral malleolus on both sides, and then the calcaneus. Okay, so all of that looks great. I'm gonna do your deep tendon reflexes now. So we'll do the bicep. So go ahead and just let your arm down here. Okay. Good. And then we're gonna do the brachioradialis. I'm sorry, this was the tricep that I just did. This is the bicep. Good. Next side. Tricep. And the bicep. And brachioradialis. Okay. And then let's do the patellar. Okay. Go ahead. Okay. Okay. All right, and then we're gonna do the ankle back here, the Achilles. Okay. All right, and then the Babinski reflex starts down here. I'm gonna use the sharper edge of this, and your feet should curl. Perfect, which they did. Okay. All right, very good. So your deep tendon reflexes seem to be intact as well. Next thing I'm gonna have you do is stand up so we can look at your spine. Okay, so we did already look at the neck, so that is all good here. I'm just gonna pull your shirt up. If you could bend over for me and touch your toes, great. So palpating down the spine. The spine is intact, there's no jump off points. Okay, and your hips are even at the SI joint here. Any pain with that?
No.
Okay, you can go ahead and stand back up. And then if you can do a little bit of a back bend as well. Great. And then lean to your left side, just, yep, perfect. And then to the right. And then if you could twist for me. Okay. Good, so good range of motion there as well. So now I'm gonna have you take a couple of steps towards this, towards the front of you. And then come back to me walking on your tiptoes. Good. And then you're gonna turn around and just walk on your heels. Okay. And then come back towards me, walk normal. And then if you could just stand with your eyes closed. And this is the Romberg's test, evaluating if there's any swaying. This is evaluating the balance. Gait was strong and there's no swaying, so it looks like balance is intact as well. Okay, go ahead and open your eyes and then you can have a seat here. Okay, so I think we've covered a lot of the things. The only thing that I'm gonna do is the sensation with your hands. So if you could close your eyes for me and tell me what number I'm writing in the palm of your hand.
6.
Again?
9. 3.
3, yes, okay. And then in this hand?
3.
Okay, perfect. Okay, let me just think if I have reviewed everything. So we did the deep tendon reflexes. We did up ears, eyes. We did neurological system. I believe I did all of the things in the head to toe assessment. So thank you very much for being my patient for the last 7 weeks. And I appreciate your time.
Thank you.